And also, just to be clear, and we also are not doctors, nor do we dispense medical information. We're trying to present all sides of this conversation to the best of our ability, but we are not doctors. We're not recommending anything. But just for people who don't know, what you're talking about is what is referred to as microdosing, where we're not suggesting, and no one is suggesting, that people go out and, go to a Dead concert and take lots of mushrooms. That's not what this looks like. What this looks like is there's a protocol that is usually supervised by someone who knows about these things. And the protocol is implemented so that the goal would be to kind of reprogram your brain and your nervous system to adapt to what I think we would all agree is a higher level of functioning. Not that you're looking to be stoned all the time, but that your brain and nervous system is operating at optimal levels. And there's a different conversation about an expansion of consciousness, which also has to do with neurogenesis and lots of fascinating expansion of the nervous system. But what we're talking about is, instead of being told there's something wrong with your brain and you were born with something wrong with your serotonin receptors, and we have the medication, and if you pay us this money, we will give you this medication. You'll take it every day for the rest of your life because you were born broken. This is an alternative perspective, that your brain has the ability, right, to be supported.
Yes, exactly. And this let me just add a further clarification. Even though the 25 milligram dose is recommended by the FDA, most medicines are adjusted according to body mass, according to patient's individual history. You wouldn't give the same dose to a 120-pound woman yoga instructor as you would to a 400-pound couch potato who's an alcoholic. I mean, just, of course, individualized, customized medicine. But to start the process, there is good logic in the 25 milligram standardized dose. However, because of what I've already said, microdosing is by definition not causing a change, and it's not inebriating. It can change consciousness in that colors are brighter. I think I have a better sense of humor. That's debatable. So you do a microdose, a medium dose, also known as a museum dose, and a macro dose. So let me use I go back and forth. You can divide it by 10 for anyone that's out there who wants to go to milligrams. But if you use psilocybin cubensis, the most one everyone is using, basically a 20th of a gram of psilocybin cubensis to a third of a gram of psilocybin cubensis, divided by 10 for milligrams. That's in the microdose range. You feel what we call liftoff, typically over a third of a gram of psilocybin cubensis. You actually feel a little wave that happens, temporary, very short-lived. At 1 gram, you're hitting into the museum dose, medium dose. We call it the museum dose because this is very popular. That friends would take 1 gram of psilocybin cubensis, and they go to the museum and they're fascinated by art and history. You typically know them because they wear sunglasses inside the museum, because the pupils of their eyes are fully dilated. And they tend to laugh a lot. So that to me is the medium museum dose. The therapeutic dose for helping people overcome PTSD, trauma, and those severe episodes in life that harm us emotionally, the breakthrough dose is the higher dose, which is typically 2.5 grams to up to 8 grams of psilocybin cubensis. That'd be 25 milligrams to 80 milligrams of psilocybin. There's the LD50 of psilocybin mushrooms is 42 pounds. It is one of the most least toxic drugs ever studied compared to its therapeutic benefit. 42 pounds. You cannot consume 42 pounds of any mushroom. I mean, just physically impossible. So it's that non-toxic. No one's ever died. One little footnote, but no one's ever died from psilocybin mushrooms. And they're non-addictive. So for those who have not consumed them, when you have a heroic journey on these, the next day you look at the mushrooms and you go, no way, I'm not touching these, right? Because you have to process this. This is why therapeutic support is critically important. This is not a party drug. I have a DEA license. I adopted the phrase many years ago, nature provides, I don't. My father, at the end of his life, asked to do psilocybin mushrooms with me. Alexander Smith, the father of American mycology, asked me in his 70s when I was about 24, 25 to do psilocybin mushrooms with me. He published many of the new species of psilocybin mushroom. Both of these father figures, figuratively and literally, it was such an honor that they wanted to actually do a journey with me because they trusted me. With both of them, I asked them, will your partners, your wives in this case, they were in the room, do psilocybin mushrooms with us? And they both said, no way. In both circumstances, I was literally leaving the next day and I turned them down. I turned down Alexander Smith, the father of American mycology, to do psilocybin mushrooms with me because I would not be there the next day to help him process. You have your view of reality shattered. It's not shattered in a bad sense. It's explosion. I mean, you realize there's so much more out there. We're looking through these limited lenses that our consciousness and our brains have filtered out so much stimuli. When the floodgates of the senses are open and you just, everything Roland Griffiths described this and his patients described it as the ineffable. You can't explain this. Words are inadequate to explain the after consequence. So for 70% of the people, it's a beneficial experience. For 30% of the people, it's a difficult experience. And Rick Doblin and I totally agree on this. A difficult experience is not necessarily a bad experience, because a difficult experience retrospectively, even at Johns Hopkins, 14 months later, the 30% of the people who had a difficult experience thought it was therapeutically beneficial.
Interesting.
They just wouldn't do it again.